Just a nurse. That was what Dr. Hargrove called her during morning rounds on her third day at Mercy General Hospital in Houston. Not with malice, not yet. Just dismissal. The way you might acknowledge a coffee machine that worked reliably but didn't deserve a name. Ashley Cooper didn't flinch when he said it. She had learned, over 18 months of disappearing into the fluorescent-lit corridors of this place, how to let words pass through her like they were written in water. Just a nurse. Yes. Exactly. That was the point. The fluorescent lights hummed their constant electronic prayer above the third-floor cardiac unit, a sound that lived underneath everything else, underneath the monitors beeping their rhythmic assurance, underneath the murmur of residents discussing ejection fractions, underneath the squeak of her shoes on linoleum that had been mopped at 4 a.m. by someone else who preferred invisibility. The antiseptic bite of the hospital was so complete it had become the air itself. Chlorhexidine and betrayal and the particular loneliness of people who had chosen to heal others because they couldn't heal themselves. Ashley pushed the med cart down the hallway with her left hand gripping the handle so tightly her knuckles had gone white. Not from anger. From the tremor that lived in her hands now, the one that started without warning and wouldn't stop until she focused on something, a vital sign number, a patient's breathing pattern, the precise angle of an IV catheter. Muscle memory looking for work. Her right hand, she kept visible and steady, moving with deliberate calm as she checked room numbers against her clipboard. 316, 318. 320, the familiar choreography of a life lived in small, manageable pieces. In 322, old Mr. Patterson was asking for pain medication again, and she gave it to him with the kind of focused attention that made people believe they were the only person she cared about, which was true, but not in the way they thought. She cared because it was her job. She cared because the alternative was not caring, and she had stopped being able to distinguish between those two things. The syringe went into his line with the smoothness of someone who had done this 8,000 times, maybe more. She had lost count around year 7. "You're good at that," Mr. Patterson said, the morphine already loosening his tongue. "You ever think about doing something bigger?" She smiled. The smile was efficient. It said, "I appreciate you noticing." It said, "I'm fine with small." It said nothing true. By 11 a.m. she had checked on 12 patients, restarted 2 saline drips, helped a post-op cardiac patient to the bathroom and back without dropping him, and touched the pair of worn combat boots in her locker once with her fingertips, the ritual that kept her tethered to something she no longer had words for. Her locker was the smallest one in the break room, tucked in the corner behind the broken refrigerator that hummed like a dying animal. The boots were tan leather, scuffed at the heels and the toe box, with laces that had been retied so many times the fibers had started to separate. She kept them in a canvas duffel bag at the bottom, and she never opened the bag. She just needed to know they were there. The cardiac unit at Mercy General ran with the precision of a machine that had been well-oiled for decades. Dr. Hargrove had been chief of medicine for 9 years, which meant he had convinced the hospital's board that his standard of care was excellent when it was actually adequate. He had convinced them that his bedside manner was commanding when it was actually contemptuous. He had convinced them that his judgment was sound because he made decisions with such absolute certainty that doubt seemed impossible. Certainty was its own credential. Ashley had learned, in her first weeks at Mercy General, that Dr. Hargrove existed in a particular relationship with the nursing staff, cordial to the ones who deferred, invisible to the ones who worked quietly, cold to the ones who asked questions. She had calibrated herself to invisible. She wore scrubs that hung loose on her frame. She kept her dark hair in a bun so tight it pulled the skin at her temples. She moved through the hospital like someone who was trying not to take up space, as if she could eventually compress herself into something small enough to disappear entirely. But on her third day, during morning rounds on the cardiac ward, something changed. A patient in 318, a 68-year-old post-op bypass who had developed a fever despite prophylactic antibiotics, needed his central line dressing changed. The resident, a nervous kid named Chen who had been at Mercy General for 4 months and still looked like he might cry during codes, hesitated. "It's infected?" Chen asked, looking at the small crusting around the catheter site, the erythema spreading across the sternum like a slow-motion fire. Early signs, Ashley said. She kept her voice level, neutral. We should switch to a peripheral and get blood cultures before the fever spikes further. Chen looked at her like she had spoken in a foreign language. It's my call to make, Dr. Hargrove said, materializing beside them the way he always did, suddenly, as if he had been waiting in the walls for someone to mention medicine without sufficient deference. He was a tall man, mid-50s, with the kind of jawline that probably photographed well in the hospital's glossy brochures. His tie was silk, and his stethoscope hung around his neck more as decoration than tool. We'll monitor it. The culture results won't come back for 36 to 48 hours, Ashley said. By then. I said we'll monitor it, Hargrove repeated, and now his voice had developed an edge, like ice creaking under pressure. You're good with your tasks, Ms. Cooper. Let's keep it that way. He turned and moved on, his entourage of residents flowing behind him like schools of fish. Chen stayed behind, looking uncomfortable, and Ashley returned to preparing the dressing change with the understanding that she had just violated an unspoken rule nurses in hierarchies like Mercy General were meant to execute, not advise. She was there to carry out orders, to be a pair of hands that followed protocol. Her thinking was not part of the job description. She changed the dressing anyway, because it needed changing, using meticulous technique that had been drilled into her body by 17 years of military medical training. The 14-gauge peripheral for went into the left antecubital fossa on her first attempt, the flashback of blood appearing exactly where her hands predicted it would. The blood cultures came out clean, preliminary, but she could feel the infection's timeline in the warmth of his skin. It was progressing. It would show up in the next culture, probably within 12 hours. By afternoon, she had almost forgotten about it. At 2:06 p.m., a motorcycle accident came through the ER, a Marine Corps medic named Rodriguez, attached to the 3rd Battalion out of San Diego, who had been riding home from the grocery store and met the side of a pickup truck at 43 miles per hour. The impact had fractured his femur and his tibia, given him a moderate concussion, and left him with a 3-inch laceration across his right shoulder blade that was still bleeding through the pressure dressing when they rolled him up to the surgical floor for observation and waiting. He ended up in 3C, 2 rooms down from Mr. Patterson, and by evening he was sitting upright in bed with his left leg in a temporary splint, his shoulder bandaged, and the particular restless energy of a young man who had survived something that should have killed him and couldn't quite believe it. His wife sat beside him in the visitor's chair, her hand gripping his hand so hard her knuckles had turned white, and when Ashley came in to check his vitals, Rodriguez watched her the way a hunting dog watches movement in tall grass. She didn't notice at first. She was focused on the details, his BP steady at 128/74, his oxygen saturation good at 98% on room air, the pattern of his breathing regular and controlled. She checked his full line, a standard peripheral in the right antecubital fossa, and moved to change the gauze on his shoulder laceration. The bandage came away, and the wound revealed itself, deep but clean, the edges still red but not infected, and as she cleaned it with meticulous precision and began the suture work, she heard his wife say something quiet to him. "He keeps staring," she whispered. Ashley's hands moved without interruption. The stitches went in with the kind of practiced fluidity that turned complex anatomy into simple geometry. She was using a running subcuticular technique, the kind that the surgical residents at Walter Reed had taken months to master but that she had taught to corpsmen in field situations where there was no time for teaching, only for the transfer of knowledge through watching hands move exactly right. Her stitching was a form of meditation. It was the only time her hands didn't shake. When she looked up, Rodriguez was staring at her with an intensity that had nothing to do with pain medication and everything to do with recognition. "You learned that in the military," he said. It wasn't a question. Ashley's hand stilled for exactly 1 second. 1 second where the whole architecture of her disappearance trembled. Then she finished the knot, clipped the thread, and covered the wound with fresh gauze. "I was a surgical tech for 8 years, she said, which was technically true if you didn't count the operative word senior that belonged in front of chief, and that petty officer that belonged after it, and all the other context that would collapse the careful fiction of her life here." "That's not surgical tech work," Rodriguez said. He was still staring. "I saw that stitch in Sanjin." There's only one person who ties off bleeders like that. His wife squeezed his hand. You're on the good painkillers, baby. But Ashley had already turned away, already moving to the next task, already rebuilding the walls that Rodriguez's voice had cracked open. She finished her med pass. She checked vitals on the other 6 patients in her section. She filed paperwork with the focused attention of someone who was practicing the geometry of normalcy. At 4:15 p.m., as she was refilling the water pitcher in the break room, she heard the sudden blare of the 4-pump alarm from 318, the bypass patient, the fever, the infected line. It was a sound like a scream, high-pitched and urgent, and her hands moved on their own, reaching for tourniquets that weren't hanging there, reaching for the trauma shears that weren't on her belt. Her body remembered the shape of crisis before her mind could catch up. The tremor came back, worse this time, a full-bodied oscillation that made the water pitcher shake in her hands. She set it down on the counter and gripped the edge of the sink, breathing through her nose the way the VA psychiatrist had taught her, in for 4 counts, hold for 4, out for 4, until the tremor subsided into the manageable baseline shake that was now her permanent condition. By the time she got back to 318, Dr. Hargrove was already there, assessing the fever spike on the monitor with the serene confidence of someone who had been right all along. The culture had come back positive. Staph aureus, sensitive to vancomycin. The infection that Ashley had warned about 12 hours ago, the infection that should have been treated prophylactically, that would now require for additional days in the hospital and probably an additional $47,000 in treatment costs, was blooming across the patient's bloodstream like something alive and hungry. Hargrove ordered the antibiotics without acknowledging that the situation had evolved from something preventable to something managed. He was giving an order to Chen, his tone absolute and final, when he happened to glance up and see Ashley standing in the doorway. His eyes tracked her for exactly 2 seconds. Long enough to catalogue her? Long enough to recognize, in that moment, something that made him smile. It was not a kind smile. The staff meeting room at Mercy General was standing room only that Tuesday morning in late September. 114 people crammed between beige walls under fluorescent lights that hummed like insects trapped in a cage. Dr. Hargrove stood at the front in his custom-tailored charcoal suit, the kind that cost more than most nurses made in a month. He had that expression on his face, the one that meant he'd decided someone was worth hunting. His eyes found Ashley in the back row, near the door where she always positioned herself. Never front and center. Never drawing attention. Just watching, calculating, present without being seen. "I'm making a prediction," Hargrove announced, his voice smooth as olive oil. He pointed at her like she was a specimen under glass. "Our little Nightingale here won't last the week. She's too soft. Too quiet. Let's call it a gentleman's bet." He turned to the administrators beside him. "I say she cracks by Friday. Anyone want to put money on it?" Laughter rippled through the room like a shockwave. The attending physician smiled. The younger residents laughed harder, eager to please the man who signed their evaluations. The charge nurses glanced at Ashley with something between pity and schadenfreude, that peculiar joy people feel watching someone else get humiliated. Ashley took one measured breath. The kind of breath they teach you to take when you're holding someone's open chest cavity and the bleeding won't stop. She watched Hargrove's face, the way his smile widened as he waited for her to flinch, to look away, to give him the satisfaction of her shame. She did neither. A single tear escaped down her left cheek. She wiped it without breaking eye contact, her hand moving with the precision of muscle memory, the way a marksman cleans their scope. Then she turned and walked out of the room as the laughter continued behind her. That night, alone in her apartment in the Montrose district, Ashley stood in the darkness of her kitchen holding a bottle of water she didn't drink. The combat boots sat in the bottom of her hall closet, wrapped in their original army duffel bag. 18 months since she'd touched them. 18 months since she'd become someone else entirely, someone smaller, quieter, someone who could be bet against like a horse at a track. The apartment was silent except for the distant rumble of traffic on Kirby Drive and the air conditioning unit cycling on. She thought about Sanjin. She thought about the field hospital tent in Helmand province with mortar rounds coming in so close you could smell the explosive residue burning your throat. She thought about Captain Marcus Chen with shrapnel in his femoral artery and 40 seconds to keep him from bleeding out into the sand. She had done that. Hand steady as surgical steel. No tremor. No hesitation. That woman could not be rattled by a man in a suit. But that woman was supposed to be dead. Wednesday afternoon in the hospital cafeteria, Ashley sat alone at a small table in the corner with her tray, tomato soup, turkey sandwich on wheat, a bottle of iced tea. She was cutting the sandwich into quarters, a habit from the field that never left you: eat small, eat fast, stay ready to move. Dr. Hargrove appeared from behind the beverage station like a shark sensing blood. He was walking toward the exit when he accidentally veered toward her table. His elbow caught the tray in that casual but not casual way that had been practiced in his mirror 100 times. The tray went airborne. Soup splashed across the tile in a red-orange arc. The sandwich landed face down. Silverware clattered like a discord of bells. Oops. Hargrove didn't slow down. Better clean that up, sweetheart. Before someone slips. The cafeteria went quiet. 37 people watched to see what Ashley would do. She knelt on the wet floor without a word. Found the spoon first, it had slid nearly 6 feet across the tile. Collected the sandwich in her napkin. Gathered the plate. The warmth of the soup soaked through her scrubs at the knee. Someone was already bringing paper towels. Someone else was saying something about Dr. Hargrove being such a jerk. The words meant nothing. Ashley had been trained to operate in combat zones where actual bullets were coming at you, and she'd learned long ago that what people said about you mattered far less than what you did next. She stood, wiped her hands, and got back in line for another sandwich. But that wasn't the worst part. Friday afternoon came in like a cold front, the kind that makes the emergency department suddenly busier, as if the barometric pressure changes triggered something primal in the human body. Ashley was working the main trauma bay, restocking supplies, when Dr. Hargrove appeared at the nurse's station. He had a patient chart in his hand. He stood directly in front of Ashley, close enough that she could smell his cologne, something aggressively expensive that probably cost $300 a bottle. He dropped the chart on the floor at her feet. Let it fall spread eagle across the tile, pages scattering like a wounded bird. Pick that up, sweetheart, he said loudly enough that everyone working within 20 feet could hear him clearly. Or is bending over not in your skill set? The charge nurse gasped. One of the residents looked at their shoes. A phlebotomist paused mid-draw on a blood culture. Ashley looked at the chart. Looked at Hargrove. Looked back at the chart. She knelt and gathered the pages, the folder, reorganized them with unhurried precision. Stood. Held the chart against her chest. And when she spoke, her voice came out low and level, the way a 9mm round travels through air, direct, unstoppable, leaving a permanent hole in whatever it hits. I've held the hearts of better men in my hands while they were still beating. She didn't shout. Didn't raise her voice. Didn't tremble or let emotion crack the surface. She simply stated a fact the way you state that water is wet or that gravity pulls downward. Something immutable. Something true. For just a second, one heartbeat of a second, Hargrove's smile faltered. The confidence flickered like a candle in wind. He'd expected anger, or tears, or defensive words. He'd gotten neither. He'd gotten something far worse, a woman stating with absolute calm that she'd survived things that would liquefy most people's nervous systems. Then he turned away without another word, walking back toward his office with slightly less swagger than when he'd arrived. Ashley stayed at the nurse's station, her hands completely steady, the chart perfectly aligned against her chest. She'd learned long ago that the trembling wasn't fear, the trembling was restraint. The body wanting to move, to act, to respond with the decisiveness it had been trained for, but the mind holding it back. Every muscle fiber in her shoulders was locked in place, screaming to move, and she was telling them no with the same precision she'd once told a Black Hawk full of Rangers to hold positions under sniper fire. A nurse she recognized from the ER asked if she was okay. Ashley said yes. Said she needed to take a break. Went to the break room and sat in the dark with the vending machine humming its electronic dirge and thought about how a single tear had escaped in that staff meeting and how Hargrove had seen it as weakness when it was actually the sound of her walls cracking. That night, she was assisting with an emergency appendectomy in Surgical Bay 3 when the Marine Corps medic recovering in Bay 2 saw her through the observation window. His name was Williams. He'd been admitted with complications from an IED injury to his shoulder, and he'd been watching her move through the hospital with the focused intensity of a man who'd learned to read people's competence like it was written on their foreheads. The surgeon was demonstrating proper technique for ligating small bleeders along the appendiceal artery, keeping the pressure light, the angle precise. But the resident was fumbling, taking too long, applying too much pressure. The field would start to darken with blood. Ashley moved in. The surgeon stepped back. Her hands moved on their own, muscle memory written in cells that had learned to do this in a combat hospital 37,000 miles away under conditions that would make a civilian's hand shake for weeks afterward. The knot went down clean. 1 loop. 2 loops. Tied off. The hiss of air escaping as she positioned for the next bleeder. 3 seconds. Clean. Precise. Finished. In Bay 2, Williams leaned toward his wife, who was sitting beside him holding his hand, and whispered words that made her follow his gaze. "That's a Sanjin stitch," he said quietly. "I've only seen one person tie off bleeders like that." His wife didn't understand what that meant. She didn't know that there was a particular technique taught only to trauma surgeons operating in the worst possible conditions, that you could tell a Sanjin-trained surgeon by their hands alone, that what she was watching was someone operating at the absolute highest level of their field in a moment when it didn't matter that they were pretending to be just a nurse. "Who?" his wife asked. Williams didn't answer. He just watched through the window as Ashley completed the case with the kind of efficiency that spoke of someone who'd done this 1,000 times when lives actually depended on the speed of her hands. And he thought about the whispers he'd heard in the halls about the quiet new nurse, about how the Marine medic had been staring at her, about how she never made a mistake, about how she seemed to exist in the hospital like a ghost, present but separate, wounded but not broken, skilled in ways that didn't have explanations. But that wasn't the worst part. Saturday evening, the ER erupted like someone had opened a door to chaos itself. 4-car pile-up on Interstate 10, near the Ward Drive exit. 7 casualties incoming. 2 critical. The trauma alert started sounding, that specific urgency encoded in the hospital intercom that made every blood vessel in Ashley's body constrict. A 23-year-old woman arrived unconscious and hypotensive. Muffled heart sounds. The kind of presentation that starts the clock running inside your head, counting down from 5 minutes because that's how long you have before the cascading failures become irreversible. Ashley moved into position, her hands already reaching for the equipment before anyone asked her to do anything. The on-call surgeon was 23 minutes out, stuck in traffic on the West Loop. The ER attending stood frozen, staring at the monitor, running through differential diagnoses in a way that would take 6 minutes they didn't have. Pericardial effusion. Tamponade. The patient's pressure dropping by 2 points every 30 seconds. Ashley prepped the subxiphoid area with chlorhexidine, her movements economical and certain. The needle in her hand was a 16-gauge angiocath. She positioned it at the subxiphoid notch, advanced at a 45-degree angle toward the left shoulder, felt the characteristic give as it pierced the pericardial sac. The syringe filled with blood. She withdrew 370 milliliters of blood from around the patient's heart. The monitor shifted. The patient gasped. The pressure rebounded. The tremor in the tissue-thin margin between life and death shifted back toward the living. Dr. Hargrove arrived at the bay entrance just as Ashley withdrew the needle and began stripping off her gloves, her movements already transitioning toward the next task. His face went purple with something that might have been rage or might have been the realization that he'd watched someone just violate every boundary of her job description in order to save someone's life. "You just performed a pericardiocentesis." His voice climbed. "You're a nurse. That is so far outside your scope of practice I'll have your license by Monday." Ashley said nothing. She disposed of the needle. Turn to the charge nurse. Get an EKG. Get the cardiologist down here. This patient needs imaging to rule out underlying effusion causes. Hargrove stormed toward his office, and by the time he reached it, he already had his personal cell phone in his hand, dialing the number for the hospital board president, a man named Sterling with whom he golfed every Saturday and with whom he'd made certain arrangements about mutual professional support. By Sunday morning, the investigation had already been triggered. By Monday afternoon, Hargrove had contacted every reference listed on Ashley's nursing school applications. By Wednesday, an outside consultant had been brought in to review every single chart she'd touched in the past 6 months. Ashley went to work. Did her job. Didn't explain. Didn't defend. Because the real explanation would require telling them why a senior chief petty officer with trauma surgeon credentials was working as a floor nurse in Houston, why she'd walked away from the military with PTSD bad enough to make her hands shake during routine procedures, why she'd told no one where she went to disappear except for the VA hospital intake form and the apartment leasing agent. Those answers weren't hers to give to people who'd already decided what they believed. The Saturday evening 4-car pileup on IE-10 hit Mercy General's ER like shrapnel. Dispatch called it in at 6:06 p.m., 2 sedans, 1 pickup truck, 1 minivan wrapped around the concrete divider. 7 patients incoming. 3 classified as trauma alerts. The ER doors burst open and the controlled chaos of preparation shifted into something harder, sharper, more primal. Gurneys rolled. Nurses moved in practiced formation. The smell of diesel fuel and burned rubber clung to the paramedics' uniforms as they called out vitals in rapid-fire succession. Ashley stood at Bay 4, already gowned and gloved, her movements economical. No wasted motion. No drama. She'd lived through worse than a highway collision, though nobody at Mercy General would ever know it. The 23-year-old female patient arrived third, transported from the lead sedan. Vitals were catastrophic. Blood pressure 68 systolic. Heart rate 146. Respiratory rate 32 and climbing. The paramedic's voice was tight with controlled urgency, massive blunt force trauma to the anterior chest. We're seeing muffled heart sounds and jugular venous distension. She's going into shock. Cardiac tamponade. Blood filling the pericardium, the membrane surrounding the heart. The heart trapped in its own cage, unable to beat properly. The patient was drowning from the inside. Without intervention, she had minutes. Not hours. Minutes. Dr. Hargrove appeared at the bay entrance, his white coat pristine, his expression already annoyed at being pulled away from the administrative dinner he'd been attending upstairs. He glanced at the monitor, at the patient's ashen face, at Ashley preparing the equipment with methodical precision. Get the cardiothoracic surgeon down here, he snapped to the nearest resident. This is a surgical suite emergency, not an ER procedure. Ashley continued her preparations without acknowledging him. She was already opening the sterile field, already positioning the ultrasound probe. The patient's breathing was becoming labored, that distinctive quality of air fighting its way through a system in collapse. 22 minutes until the cardiothoracic team could be assembled and ready. The patient had maybe 8. What are you doing? Hargrove's voice sharpened. He stepped closer to the bay. Step back. That's an order. Ashley's hands didn't pause. She was already marking the insertion site, the 5th intercostal space, midclavicular line. The anatomy was precise, unchanging, the same whether you learned it in Sanjin or Houston. The ultrasound confirmed what she already knew, fluid surrounding the heart, pressure building, cardiac output dropping. The monitor showed a BP trending toward 55. Cooper, I'm talking to you. Hargrove was in the bay now, his voice rising. You are outside your scope of practice. You are a nurse. You will step away from this patient or I will have security remove you. The room went silent for exactly 1 second. The kind of silence that happens when momentum shifts. When someone does something that shouldn't be possible. Ashley looked up from the ultrasound probe, and her eyes met Hargrove's for just long enough that the resident assisting her took a small step backward. Then she returned to her work. "Get him out of my bay," she said. Her voice was flat, instruction grade, the kind of voice that doesn't ask twice. She wasn't looking at Hargrove anymore. She was looking through him. "I need focused people in here. You're diluting my air." It wasn't defiance. It was worse. It was dismissal. A trauma nurse, a supposed floor nurse, speaking to the chief of medicine with the tone of someone so far above him in the hierarchy that his rank didn't register. Hargrove's face flushed. His jaw clenched. But the patient's oxygen saturation was dropping. 87, 84, 81. Even Hargrove understood that this moment belonged to Ashley, and any further intervention would result in a dead patient on his conscience and a lawsuit that would shred his career. He stepped back. He didn't leave the bay, his pride wouldn't allow that, but he yielded the space. He yielded the authority. And that yielding was its own kind of devastation. Ashley's hands moved like someone remembering a dance she'd performed 1,000 times. The 14-gauge needle, the correct angle, the approach refined across 18 months of watching procedures and 3 years before that of performing them under live fire. She could feel the needle advancing through tissue, resistance, then give, then the rush of pressure releasing as the needle entered the pericardium. Fluid aspirated into the syringe. Dark. Thick. Composed of blood that had no business being anywhere except inside the vessels. 15 milliliters. 20. 25. The patient's oxygen saturation climbed. 85, 88. 91. The heart monitor's rhythm strengthened. The muffled quality to the cardiac sounds vanished. Blood pressure began its climb. 70. 75, 82. 88. The patient's color shifted from that terrible ashen gray toward something approaching human. Her breathing eased from gasping to labored to something almost regular. It took for minutes. The entire procedure. 1 minute shorter than the cardiothoracic surgeon's estimated arrival time. 1 minute that meant the difference between a patient who would walk out of this hospital and one who wouldn't walk anywhere ever again. Ashley secured the needle position, taped it down with the precision of someone trained by people who understood that in field conditions, you might not get another chance. She stepped back from the bay. She didn't look at Hargrove. She didn't acknowledge his presence at all. She simply began removing her gloves, and the room seemed to exhale. The resident, a fourth-year med student named Torres, stared at her with the kind of expression that happened when someone watched an impossible thing become real. "How did you know exactly where to?" "Procedure's complete," Ashley said. Her voice had already shifted back to something deferential, something that wouldn't draw attention. "Patient stabilized. She needs cardio consult and probably a bed in ICU for monitoring." She turned toward the supply cart, away from both the resident and Hargrove. "Tell the surgical team she's stable for transport when they're ready." Hargrove was still standing in the bay entrance. His hands had gone very still at his sides. Ashley could feel the weight of his attention like pressure against the back of her neck, not anger now, something darker. Not frustration but fear. Fear of something he didn't understand, something that had just revealed itself in his own hospital and underneath the fluorescent lights and in front of witnesses. He left the bay without speaking. His footsteps carried him down the corridor toward the administrative offices, and Ashley knew with the absolute certainty of someone who'd survived worse politics than hospital hierarchy that the next phone call was already being dialed. She worked the rest of the evening in Bay 2, then Bay 6, treating a minor laceration and a separated shoulder, and nobody spoke to her directly. The silence wasn't peaceful. It was the silence before a decision became irreversible. The board president picked up on the second ring. Hargrove's voice was measured, controlled, the voice of a man who understood exactly how to frame a narrative to allies. There was an incident. A concerning incident. A nurse, yes, the same one from before, had performed a procedure clearly outside her credentials. Pericardiocentesis. No, there was no evidence of any formal training. Yes, the patient had survived, but that was coincidental. The real issue was scope of practice, patient safety protocols, the integrity of the hospital's medical standards. What if she'd paralyzed someone accessing the pericardium incorrectly? What if the next patient wasn't so fortunate? The board president listened the way people listen to their friends. Without demanding evidence. Without context. With the kind of automatic agreement that privilege provides. By the time Hargrove hung up, the decision had been made. An investigation. A consultant from Dallas. A full review of every chart Ashley had touched in the past 6 months. Every medication she'd administered. Every procedure she'd assisted with. Every decision. Every note. The next morning, Ashley received the notice in her employee mailbox. Suspended pending investigation. Effective immediately. A consultant would be arriving Monday to conduct formal interviews. All access to the hospital restricted except for the HR office. All clinical duties suspended. She held the notice without reading past the first paragraph. She'd held plenty of things that didn't matter, field dressings, for lines, the hands of dying men who wanted to know if they were going to make it. A piece of paper with official letterhead fell somewhere below all of that in the hierarchy of weight. By Wednesday afternoon, she was sitting in the VA hospital waiting room in Northwest Houston, surrounded by people who understood without needing explanations. The corpsman with the prosthetic leg and the prosthetics pamphlets clutched in one hand. The woman in the faded Marines t-shirt, the baby asleep against her shoulder. An elderly man with a Vietnam-era tattoo on his forearm, waiting for his own appointment. The walls were that particular institutional color, not quite beige, not quite surrender, and the smell of industrial cleaner fought against something older, something like regret. Ashley's psychiatric appointment was scheduled for 2:15 p.m. It was 2:02 and she was watching the second hand on the wall clock, that horrible mechanical division of time into smaller and smaller pieces, when she realized she'd been hiding from the wrong people. These people in this waiting room, they already knew. They'd watched the tremor in their own hands. They'd spent nights understanding why loud noises made the body respond like a threat. They'd come back from places that shouldn't exist and tried to pretend normalcy in a country that had already moved on to the next war, the next news cycle, the next reason to not ask hard questions. The corpsman looked up at her. He had kind eyes, the kind that had seen terrible things and decided compassion was the only reasonable response. "Rough one?" he asked. Not prying. Just acknowledging. Ashley nodded. And then, for the first time in 18 months, she didn't fight the memories. They came like flood water through a broken dam, and instead of pushing them back down into the dark place where she kept them locked, she just sat there and let them surface. Sanjin. The 847 combat surgeries. The hours with flashlights and needle-nose pliers and the weight of decision-making that shouldn't have fallen on anyone her age. The hands that shook now, not from cowardice but from knowing exactly what they were capable of destroying. The woman with the baby glanced over. "Hospital?" she asked. "Mercy General," Ashley said. "Houston." The woman made a small sound that wasn't quite a laugh. "My husband was at St. David's. Orthopedic surgeon told him his career was over. Told him in front of interns like he was announcing the menu." She shifted the baby's weight. "He's running a prosthetics clinic now. 47 patients last month." The clock ticked toward 2:15. Ashley didn't move. She didn't check her phone. She just sat in that waiting room with people who understood the weight of carrying knowledge that couldn't be shared, the gravity of decisions made without the luxury of second-guessing, and something inside her that had been wound tight since the moment she'd left Sanjin began, very slowly, very carefully, to release. The psychiatrist's office at the VA hospital in Houston didn't feel like a typical medical space. No beeping monitors. No fluorescent overhead panels buzzing like angry wasps. Just a woman in her 60s with kind eyes, a tissue box, and a leather chair that had absorbed decades of trauma that words couldn't quite contain. Ashley sat across from her, hands folded in her lap, and said nothing about the trembling that had started 6 weeks ago during a routine debridement in Sanjin. She didn't mention the way her fingers would shake when she held a suture needle. She didn't mention the nightmares or the way certain smells, copper, diesel exhaust, the particular chemical stench of battlefield triage, could send her right back to a field hospital where the screaming never fully stopped. Your primary care provider referred you for PTSD evaluation, Dr. Reeves said gently. How long have you been experiencing symptoms? Ashley exhaled. The words came slow. 18 months. Maybe longer. Hard to say when you're trying not to notice. And what triggered the referral? Shaky hands during a procedure. Dr. Reeves wrote something down. Tell me about the work you're doing now. Nursing. General floor nursing. Vitals, medications, patient comfort. Ashley's voice stayed level. Clinical. Nothing that requires the kind of precision I used to do. Used to do. Ashley met her eyes for a moment, then looked away. Before I left. Before you left the military. Yes. The silence stretched between them like a living thing. Dr. Reeves didn't push. She just waited, pen poised, letting the quiet do its work. Ashley knew this technique. She'd seen combat medics use it on Marines who couldn't talk about what they'd seen. Sometimes the person fills the space themselves. Sometimes they don't. Either way, the waiting itself is a kind of permission. I worked in trauma, Ashley finally said. 847 combat surgeries across for deployments. You hold that many people's hearts in your hands while they're still beating. You learn that fear is just information. Pain is just data. You train the tremor out of yourself because other people's lives depend on you being steady. She paused. And then one day you can't be steady anymore. And instead of facing that, instead of asking for help or admitting you might need to sit in a room like this with someone who understands what you've carried, you just leave. You take a flight to a place nobody knows you. You find the quietest hospital in Texas and you push a medication cart and you tell yourself that's enough. That's living. Dr. Reeves didn't write anything down. She just listened. But it's not living, Ashley continued. It's hiding. And the people hiding with you, the ones in waiting rooms like the one downstairs right now, the ones who served, the ones who carry the same weight, the ones who get it without you having to explain the sound a body makes when it stops making sound, those are the only people who actually understand. And I've been running from them. From people like me. Because facing them means facing what I left behind. The appointment lasted another 20 minutes. Dr. Reeves prescribed a combination of sertraline and prazosin. She recommended a weekly trauma-focused cognitive behavioral therapy group. She said 3 things Ashley needed to hear: that what she was experiencing was treatable, that seeking help wasn't weakness, and that the skills that made her an exceptional combat medic, the hypervigilance, the rapid decision-making, the ability to function under impossible pressure, those weren't flaws to be ashamed of. They were gifts. They just needed context. They needed a place to exist without destroying the person carrying them. Ashley walked out of the office and back into the waiting room, and for the first time in 18 months, she didn't feel the need to look away from the other veterans there. A young man missing his left leg. A woman with a service dog. An older man in an army jacket, eyes that had clearly seen things nobody should have to carry alone. They existed in a shared understanding that required no explanation. This was the language of people who'd been forged in places that didn't exist on most maps. She was still thinking about that when her phone buzzed on Thursday morning. The text came from the HR department at Mercy General, * report to office 7 a.m. before shift. * not a request. A command. Ashley knew exactly what was coming. Dr. Hargrove had been building his case for 2 weeks, the incident reports about her shaky hands during the pericardiocentesis, the suspicious question sent to her nursing school asking about her background and previous employment history, the outside consultant he'd brought in to audit 6 months of her charts looking for any mistake, any deviation from protocol, any reason to justify what he'd already decided. She arrived at 6:55 a.m. wearing clean scrubs, her badge already off the lanyard, anticipating that they'd ask for it back. The HR director, Patricia Vance looked uncomfortable. She slid a manila folder across the desk. "Dr. Hargrove has requested your immediate termination," she said quietly. "The board has reviewed his concerns about your clinical judgment, particularly the unauthorized pericardiocentesis performed on a patient in full cardiac tamponade. While your intervention did technically save the patient's life, you exceeded the scope of nursing practice, performed an invasive procedure without physician authorization, and endangered the hospital's liability position." Ashley didn't argue. She didn't defend herself. There was no point. The truth would require her to explain who she actually was, what her real credentials were, why she could perform that procedure in her sleep because she'd performed it approximately 473 times under fire in Sanjin. And if she said any of that out loud, questions would follow. Who she was. Where she'd come from. Why a woman with her background was working as a floor nurse in Houston. "Your final paycheck will include 2 weeks severance," Patricia continued, sliding a termination letter across the desk. "Effective immediately. You'll need to surrender your badge and access card. Security will escort you to collect your personal items." The security guard was young, maybe mid-20s, clearly uncomfortable with the situation. Ashley opened her locker, the one in the break room where she'd kept her extra scrubs and a water bottle and not much else. Someone had already removed the single photograph she kept there, a faded image of a combat medic standing in front of a field hospital tent in 2011, all of them grinning like they didn't know what the next 3 months would cost them. She didn't ask where it went. She just closed the locker and turned to leave. That's when the code blue alarm screamed through the hospital. The sound itself was mechanical, urgent, wrong. Room 2A. Cardiac step-down unit. Ashley's feet moved before her brain caught up, following the muscle memory that 18 years of medicine couldn't burn out no matter how hard you tried to disconnect from it. The security guard said something about her not being allowed to respond, but she was already moving through the corridors, the way nurses moved during a code, not running, just walking very fast in a straight line with perfect purpose. The code team was already assembled when she reached the room. The cardiac step-down attending, Dr. Mills, was struggling with an airway setup. The resident was panicking. The patient on the bed was an Air Force colonel, mid-60s, full cardiac arrest. His chest wasn't rising. His oxygen saturation was dropping. The monitor showed a rhythm that was technically organized but clinically useless. Ashley saw it instantly. Tension pneumothorax. Right side. Tracheal deviation. Breath sounds absent on the right. The pressure inside that chest cavity was building, collapsing the lung, pushing the heart sideways, killing him. Needle decompression, she said quietly. Second intercostal space, midclavicular line. Right side. Dr. Mills looked up. "Cooper, you're suspended. You need to leave." "He's got a tension pneumo," Ashley said. She was already moving, pulling the 14-gauge angiocath needle from the crash cart with the kind of fluid precision that comes from doing something hundreds of times. You want to establish an airway, but the airway won't matter if the pressure in that chest keeps building. The pressure kills him first. She didn't wait for permission. She didn't ask again. She positioned the needle, a sterile technique, perfect angle, the kind of muscle memory that lives in your hands long after you try to forget who taught you, and inserted it into the chest wall. The hiss came immediately. The sound of air escaping, pressure releasing, a body suddenly able to breathe again. The colonel gasped. His oxygen saturation climbed. 92, 95. 97, his heart rate stabilized. His rhythm converted to something that looked like actual life instead of the electrical ghost of it. The room went so quiet you could hear the ventilator wheeze its mechanical rhythm in the next bed over. Then Dr. Hargrove walked in. His eyes moved from Ashley to the colonel to the monitor to the needle in the chest wall, and something in his face shut down completely. Not shock. Not gratitude. Just a calculation happening in real time, a man watching his narrative collapse and knowing he was running out of moves. "Security," he called out, his voice sharp. "This woman is assaulting a patient." Remove her immediately. The charge nurse, Patricia, not the HR Patricia, a different Patricia who'd worked with Ashley for 8 months and had watched her save lives without taking credit for any of them, moved to stand directly between Hargrove and the Colonel's bed. She just saved his life, Dr. Hargrove. She performed an invasive procedure without authorization. She's no longer employed by this hospital. She has no authority to touch any patient. She's assaulting a patient and I want her removed. The Colonel's eyes were open now. Weak, but conscious. He looked at Ashley with the kind of recognition that only comes when someone pulls you back from the edge of something you didn't plan to cross. She saved my life, he said quietly. I was gone. She brought me back. Hargrove's jaw tightened. His voice dropped to a hiss, and there was something in it that sounded like the last breath of a man who'd just realized the game was ending. You're done here. Every hospital in Texas will know exactly what you did. I'll make sure you never work in healthcare again. Not as a nurse. Not as anything. Ashley didn't respond. She just backed away from the bed, and as she turned to leave, she caught sight of herself in the monitor's reflection. Not the nurse who'd been hiding. Not the woman who'd pretended to be smaller than she was. Just a person who'd done what needed doing, who'd made a choice in a split second, who'd chosen to act instead of hide. Later that afternoon, after Ashley had been escorted from the building and was sitting in her apartment staring at nothing, Dr. Hargrove sat in his office and made a decision. He pulled up the security footage from the past 2 weeks, looking for something, anything, that would justify what he'd already said, already done, already decided. His hands found what they were looking for. Video of him knocking over her lunch tray in the cafeteria. Video of him throwing the patient chart at her feet. Video of him looming over her in the hallway with his voice dropped low enough that nobody else could hear what he was saying but loud enough that his contempt was visible in every frame. He moved his cursor toward the delete button. The hospital IT director, Marcus Chen, an Army veteran who'd served 18 years before transition into cybersecurity, was monitoring the server in real time. He watched the attempted deletion. He'd already backed up every frame, every second, every moment that proved exactly what kind of man Dr. Hargrove was, to an external drive that no hospital administrator could touch. He watched the man try to erase the evidence of himself. Then he started making phone calls. The code blue alarm shrieked through Mercy General's cardiac step-down unit at 0614 hours. Room 2A. The monitor showed a rhythm that wasn't VTAC, jagged and erratic, the electrical storm of a heart deciding it was done. Ashley was clearing her locker when the overhead crackled. She was already fired. Her termination papers sat in the administrative office, signed at 1,700 hours the previous day. Hargrove had made sure everyone knew. Made sure the board saw her as reckless, dangerous, outside her scope. But a code blue doesn't care about paperwork. She moved. Boots on tile. 1, 2, 3, for down the corridor toward room 2A. The on-call cardiologist was in Galveston, 20 minutes away. The resident was frozen beside the bed, fingers fumbling with defibrillator pads. The patient was the Air Force colonel who'd been admitted 3 weeks earlier with crushing chest pain, the one she'd saved during the pericardiocentesis that started all of this. The one Hargrove said she had no right to touch. Charge to 200, Ashley said. Not a request. A command. Her voice had changed. The resident didn't even hesitate. The machine whined. The colonel's body arched. Flatline became VTAC, became a rhythm that looked almost like a heartbeat. Almost. The monitor kept climbing, 40, 55, 67, 78, but it wasn't holding. The for access was blown. She could see the infiltration in his wrist, the fluids pooling in the tissue instead of the vein. No medication would reach him this way. She grabbed a 14-gauge angiocath and hit a femoral line in 8 seconds flat. The rhythm responded. Epinephrine running. The monitor steadied. 120 systolic. Not great. Better than dead. I need a 12 lead, she said. And call cardiology back. Tell them we've got spontaneous return of circulation. The resident stared at her like she'd materialized from another dimension. She probably looked like it, standing over the patient in scrubs with her locker clearance badge still hanging from her neck, terminated but present, fired but necessary. The man on the bed opened his eyes. His hand found hers. His grip was weak but deliberate. "You again," he whispered. "Again," Ashley confirmed. "Try to stay alive this time." Security found her 20 minutes later, sitting in the family waiting area while the cardiologist stabilized the colonel upstairs. She didn't resist when they asked her to wait in the administrative office. She didn't argue when they said her presence at the patient's bedside had constituted an unauthorized violation of her termination status. Rules were rules. Even when the rules were written by someone trying to erase you. But that wasn't what changed everything. 2 weeks later, the hospital loudspeaker crackled during morning rounds, "Ashley Cooper to the main entrance. Ashley Cooper to the main entrance. Air Force Colonel requesting head of medicine." Dr. Hargrove was in the hallway when the announcement echoed. His face shifted, first confusion, then something like confidence. An Air Force colonel probably wanted to thank him for the excellent care his institution had provided. Hargrove always took credit for the saves that mattered. He strode toward the main lobby like a man walking toward his own coronation, his white coat pristine, his hair perfectly combed, his bearing the careful architecture of someone who'd spent 20 years convincing people he was worth respecting. He froze in the doorway. Ashley stood beside the information desk in civilian clothes, dark jeans, a blue button-down, her hair down for the first time anyone at Mercy General had seen it. Next to her stood an Air Force colonel in a wheelchair, recovering still, weak in the shoulders but rigid in the spine. Behind the colonel stood a young airman, standing at attention, his uniform sharp enough to cut. And behind them, lined up like witnesses, were 5 men in civilian clothes with the unmistakable bearing of people who'd carried weapons professionally. One of them was the Navy hospital corpsman who'd worked on the unit 2 years ago. Another was the Marine Corps medic who'd recognized her surgical technique during the appendectomy. The third was Marcus Chen, the Army veteran IT director who managed Mercy General's entire security infrastructure. The fourth was a SEAL team leader who'd transferred to work as a tactical paramedic consultant. The fifth was a retired Special Forces captain running the VA trauma program in Houston. "Senior Chief Petty Officer Cooper," the colonel said. His voice was thin from illness but absolute in its authority. "Thank you for saving my life. Twice." Hargrove's mouth opened. Closed. Opened again. He was trying to map what he was seeing onto a narrative that made sense. It didn't. Nothing fit. The Navy corpsman stepped forward. His hands trembled, not from fear but from something older. He was holding a file folder, weathered at the edges, official seals visible even from across the lobby. "Senior Chief Cooper served 12 years with Naval Special Warfare Command," he said. His voice cracked on the last syllable. During deployment to Sanjin Valley, she documented 847 combat surgeries. She was the trauma surgeon for 3rd Battalion, 5th Marines, a dark horse. The battalion surgeon. He opened the folder. The documents were real military documents. Medical credentials. Service records. Clearances marked classification restricted. And medals. Lists of them. The corpsman's voice steadied as he read, "Bronze Star." He paused. Hargrove's face drained white. "Bronze Star with Combat V." Another pause. The lobby had gone silent enough to hear the fluorescent lights buzz overhead. "Silver Star." And a Navy Cross. 847 surgeries. The number hung in the air like a verdict. The SEAL team leader stepped forward. He was a big man, the kind of presence that made the air pressure change, and he was looking at Hargrove with the expression of someone watching something try to explain its way out of a sniper's scope. "Senior Chief pulled my entire team out of a collapsed building during a 6-hour firefight in Helmand Province," he said quietly. "She reconstructed a femoral artery using field improvisation, flashlight and needle-nose pliers. No anesthesia. No medications. Just hand steady as surgical lasers and a refusal to let one of my guys bleed out on that floor. He looked at Ashley. You never once told anyone that story. Any of them. Hargrove turned. He took one step toward the exit. Marcus Chen, the IT director, was suddenly between him and the door. Dr. Hargrove, Marcus said. He was a compact man with signal corps tattoos visible on his wrists. I served with 101st Airborne, Fort Benning. I recognize someone covering their tracks. Marcus held up a tablet. On screen, security footage played in real time. Thursday night. 0247 hours. Hargrove at the hospital security database terminal. His fingers moving. His face twisted with concentration. Files deleting. The timestamp climbing. You spent 43 minutes trying to erase the recordings of you sabotaging medication carts, throwing patient charts, and verbally assaulting a staff member. I preserved everything. It's already with the board. Hargrove's voice when he found it sounded like gravel in a disposal. She violated protocol. She's not even a real. The SEAL team leader's voice dropped to a frequency that vibrated in the chest cavity. Finish that sentence. Silence lasted 3 seconds. The elevator doors hummed open nearby. Nobody moved. The hospital CEO arrived through the back in trance, accompanied by the board president, Hargrove's golfing partner, the man who owed him favors, the man who was supposed to make this go away. The board president's face was carved from ash. The CEO's was ice. Dr. Hargrove, the CEO said, we convened an emergency board meeting last night. We reviewed the security footage, the patient outcomes data, and a comprehensive review of every chart you claimed Ashley violated protocol on. She paused. The silence was the kind that precedes verdicts. Every single patient she touched during her suspension had better clinical outcomes than the unit average. Every accusation you filed was directly contradicted by medical records and independent consultant review. Hargrove opened his mouth. Nothing emerged. You're terminated for cause, effective immediately, the CEO continued. For gross misconduct, abuse of authority, tampering with evidence, and deliberate harm to a staff member. Security will escort you out. Your medical license has been referred to the Texas Medical Board for investigation. 2 security guards appeared, not to detain him, just to ensure he left. But the implication was clear. They were there to make sure he didn't try anything dramatic, didn't try to negotiate, didn't try to explain. 20 years at Mercy General, and it ended in 45 seconds. Hargrove's face cycled through colors, crimson to white to a shade of purple that looked medically concerning. I have 20 years here, he said, and his voice was the sound of something fundamental cracking. My reputation. My career. You can't just. The colonel spoke from his wheelchair. His voice was steady, authoritative, the voice of a man used to command. Your reputation is that you tried to destroy a decorated combat veteran because she made you feel small. That's not an accusation I'm making, Dr. Hargrove. That's your legacy. Everyone in this lobby watched it happen. And everyone will remember it. They walked him out, down the main corridor of Mercy General, past the cardiac step-down unit where Ashley had saved him, past the emergency department where she'd performed the unauthorized pericardiocentesis, past the nursing station where she'd taken every insult in silence. Staff members lined the hallway. None of them met Hargrove's eyes. One by one, they turned away. Ashley didn't watch him leave. She was holding something the colonel had handed to her, a pair of worn combat boots, scuffed leather showing decades of hard use, the sole of the right boot reinforced with multiple layers of stitching. Her boots! The one she'd left in her hospital locker when she came to Mercy General to disappear. The colonel gripped her hand. His fingers were still weak from the cardiac episodes, but his eyes were clear. Those belong to you, he said. They should stay with you. The Marine medic was already talking to the SEAL team leader. The corpsman was folding Ashley's service file with reverent precision. Marcus Chen from IT was shaking hands with a Special Forces captain from the VA program, and they were both nodding like they'd just made a decision that changed something fundamental. The colonel's aide was on his radio, reporting to whoever coordinates these things that the mission was complete, the message delivered, the truth exposed. Ashley looked down at the boots in her hands. They smelled like equipment oil and desert dust and something else, the smell of a life she'd been running from. She looked up at these 5 men who'd come to her hospital to bear witness, and her eyes filled with tears that she didn't try to hide. Not tears of shame anymore. Tears of relief. Of recognition. Of finally being seen by people who understood what those 847 surgeries meant, what Sanjin meant, what keeping your hand steady while holding another human's life together meant. "Thank you," she whispered. The corpsman's eyes were wet too. "Welcome home, Senior Chief." And that's when Ashley understood something the rest of the world had forgotten. She wasn't hiding anymore. The woman who'd been pushing bedpans and taking insults was gone. Standing in the main lobby of Mercy General Hospital, holding the symbol of her service, surrounded by men who'd bled beside her or treated her like a legend or fought to protect her integrity, she was home. Not to a place. To a people. To an understanding. To a mission that never really ended. The CEO approached her quietly, carefully, the way you'd approach a sacred thing. "Senior Chief," she said, "we'd like to offer you the position of Director of Trauma Services, effective immediately. Full authority to redesign protocols for all trauma responses on this unit." Ashley looked at the corpsman. At the SEAL team leader. At the Marine medic. At Marcus Chen. At the colonel in his wheelchair, his color better now, his breathing easier. "I'll take it," she said, "but on one condition." "Name it," the CEO said. "I split my time with the VA program here in Houston. Those are my people. The ones coming home. The ones with eyes like I had." Ashley pulled the combat boots on, lacing them with movements that looked like muscle memory activating after years of sleep. The familiar weight of them. The familiar grip. The familiar truth of them. There's no protocol that addresses what they're carrying. That changes. The colonel extended his hand. Ashley shook it, and his grip was firm now, recovering, strong. "Senior Chief," he said, "those people are lucky to have you. More than lucky. They're alive because you're going back to them." As the lobby emptied and the morning rounds resumed and Mercy General returned to the business of saving lives, Ashley stood holding her combat boots, no longer a symbol of something hidden, but of something reclaimed. The Marine medic whispered something to his wife as they walked toward the exit. Sometimes the bravest warriors carry stethoscopes, not guns. Ashley heard it. She looked up, and for the first time in 2 years, she let herself smile without measuring the cost. The terrified woman who'd arrived at Mercy General looking for anonymity was gone. In her place stood Senior Chief Petty Officer Ashley Cooper, trauma surgeon, 847 lives saved, decorated combat veteran, and finally, visible. The fluorescent lights hummed overhead as she walked back toward the trauma unit, combat boots solid on the tile, hands that had held the hearts of better men moving forward into a future where she didn't have to hide what those hands could do. If you've ever been underestimated and proved them wrong, hit that like button. Subscribe for more stories where the quiet ones become legends, and comment below, what would you do if you held a secret that could change everything?